All right. Good afternoon. My name is Danae Aber. I'm the Executive Director of the Louisiana Rural Health Association. Thank you so much for joining us for this Rural Infection Prevention and Control Training Program webinar. LRHA is happy to present this program and this webinar series with sponsorship by Well Ahead Louisiana and in partnership with Southern Evals. Today's session is part one of the Advanced Hospital Infection Prevention and Control. Part two of this webinar will be held on September 15th. So be sure to visit our website to register for that session. Just a couple of housekeeping things before we begin. The webinar is being recorded. It will be available along with a copy of the slides on our website, and I will drop a direct link to that page in the chat here in just a moment. Your line should have been muted automatically when you joined. Please remain on mute until you're asked to speak or until we get to a Q&A session so we can prevent background noise. After the webinar, we will send you a link to a brief survey to complete. I'm going to pop it in the chat and I'll also send it via email. We do ask that you please complete that survey. It's required for our grant evaluation and it helps us to continue to improve our future events. And so with that, I would like to welcome Taylor Catano, who's the founder and CEO of Southern Evals. Taylor is a board-certified infection preventionist and has previous experience as a frontline nurse specializing in critical care in both medical and surgical intensive care settings. So thank you so much, Taylor, for being here, and I'm going to hand it off to you.
Thank you so much, Danae, and hello to everybody across Louisiana, across wherever you are. I appreciate you tuning in today, and you are in for a treat. Let me just tell you, I know we have been able to cover a ton of stuff so far in our webinar series, whether you are at an RHC or a rural hospital. But hopefully you've taken value. But today we are diving into the beauty of surgery, procedure areas, and all the things that go into those areas and what the regulators are looking for. So without further ado, let's get started. All right. Okay, so shout outs this morning. First off, let's get to know each other. Let me call on a few people who I have here. Let's see, Ms. Janice Bernard. Can we unmute Ms. Janice Bernard? There we go. Ms. Janice, I should be asking you to unmute. Give it a few more seconds. All right, can't get them. Let's go to our next one, Miss Amanda Carroll. Let's try Miss Amanda. Can we ask to unmute Miss Amanda? All right, give it a few more seconds. All right. Let's go on to Mr. Todd Acosta. I know we've chatted with him before. Asking him to unmute.
Janice says she doesn't have a microphone.
Okay. All right. Well, everybody may be shy today, but we're here to learn. So let me get to starting on that. So number one, who is Southern Evals? Again, we are a team of regulatory compliance experts where we help hardworking healthcare providers increase revenue and maximize patient safety, especially when it comes to infection control. We're looking at increasing that patient safety, not only for your patients, but for your staff as well. Our values: honesty, transparency, consistency, hard work, and compassion. We are a team of nurses, so compassion is something that we always preach and we've always worked with. And what is our vision? Our big goal is to provide safer care for 1 billion patients. How do we do that? Is we give you the tools and the resources to you take back to your facility or to your clinic, and you provide safer care to your patient population. That's how we are achieving that goal. So Hospital Advanced, what are we doing today? So we are going to do a deep dive into the regulatory compliance involved with reprocessing, reusable critical equipment, instruments, and devices in the hospital setting. So for our new preventionists, this may be completely new items. For our seasoned preventionists or someone that's been in the role for a long time, we may have been through those surgical areas, through those procedural areas, and we've seen a lot of this stuff, but maybe we want to brush up. Maybe we want to know what surveyors are looking for. So this is what we're going to talk about today. So again, to recap, we talked about the 3 Ps, the paperwork, the things that we can control. Talked about all those items that you need to have in place for regulatory success. Number 2, policy and procedures. We've talked about which ones to have, how to write those policy and procedures, and how to make sure that they're available for your staff. And the last thing is practice. Last time we talked about environmental rounds, we talked about quality, and we talked about all of those pieces that make up the day-to-day for our infection preventionists. Well, with these 3 Ps, whenever we talk about sterilization, high-level disinfection, low-level disinfection, whatever it may be, that covers all of these different things: paperwork, policy and procedure, and practice. And we're going to get into that today. So remember, you are rock stars out there in Louisiana, in your hospital, in your clinic, and you can make a difference. As small as a few changes in policies or practices or things that you're looking at, those small changes can make a difference. And know that it is up to you to be a leader in your community, especially if you're in a small area where there's no one else to ask but you about those things. I'm sure you got questions about monkeypox. You are the person that they're coming to see. And to be knowledgeable is important, and you can make an impact in your community. So classifications and definitions. We're going to talk about these things, these key items, these key definitions that you need to know about as you're diving into these areas. So this is why this is so important. Out of the hundreds of surveys we do, either in hospitals or in clinics, this one thing, when it comes to sterilization, high-level disinfection, it is one of the top 3 most frequently cited standards since 2014. That's since 2014. Since then, a lot has happened. As Anchorman would say, it's kind of a big deal when you're coming down to it. Why is it one of the most frequently cited things? Is because there's so many little tiny elements that go into this whole process that surveyors are looking for. And they want to make sure that if you say you're doing something, that you are doing it that way and you are following those guidelines. So let's talk further into that. So you may have seen this before, but the Spalding classification, what it does is it tells you the minimum level of disinfection that you have to make sure that these medical devices are clean. It's separated into 3 different classifications, and those classifications talk about the levels of disinfection that you have to make sure that you are compliant. Know the class and you'll pass. That's what we always say. So the first class is critical devices. So these are the items that enter sterile tissue or in the vascular system. You can see some examples in that picture below, but a lot of times this is your surgical instruments, your cardiac catheters, your implants that you may have, also some endoscopes. So some endoscopes are required to be sterilized and are critical because they enter that sterile tissue, that vascular space. Based off the MFUs, you need to know that some of these can require sterilization. And then the devices must be sterilized, and the definition of that is defined as the destruction of all microbial life. So if you've got an OR, if you're using surgical instruments, if anything is entering sterile tissue, you have either an autoclave or a process where these things are sterilized. Even if you send them out, those are your critical devices. Second thing is your semi-critical devices, and these have been scrutinized for the past couple of years, but what are they? So these are the devices that contact mucous membranes or non-intact skin and require at a minimum high-level disinfection. HLD, it's called many different things, or you may know it as Sidex. There's a lot of different ones, and we're going to talk about those, but high-level disinfection has been a hot topic lately, or for the past couple of years. So what do we classify as semi-critical devices? Most endoscopes are semi-critical, speculums, laryngoscope blades, vaginal ultrasound probes. Those things are semi-critical devices, and these devices have to be at least high-level disinfected, which is the elimination of a majority of the microorganisms except small amounts of bacterial spores. So that is our second class. Our last class is non-critical devices. These are your everyday devices that you use either in the floor, during patient care. And these are devices that do not ordinarily touch a patient, non-intact skin. They only touch intact skin. So you see what we're talking about? It's stethoscopes, your patient carts, your vital signs machines, your glucometers. These are the items that are cleaned with your low-level disinfectants, these non-critical devices. And we'll talk about some of those non-critical devices that you see every day. We actually have a slide on that we've done on the past couple of presentations, but just a reminder slide. So going to another definition is high-level disinfection. Again, this is the process of completely eliminating all microorganisms except a small amount of spores. Many chemicals that you see on a day-to-day basis are glutaraldehyde, hydrogen peroxide, or vaporized hydrogen peroxide, like Trophon would be, or I'll just say OPA. OPA is another one. So key here, whenever you see high level disinfection or HLD, you want to make sure that you pay attention to the small details. This has been a huge focus, and every step of the process, from the test strip to the temperature to when the expiration date is, all of these are important keys to high level disinfection. And we're going to go into depth as we go through this. Next thing is instrument sterilization. Our last definition is validated process used to render a product free from all viable microorganisms. So everything is completely gone. So what are types of sterilization? You've got steam, you've got gravity displacement steam or a pre-vacuum steam. You got ethylene oxide or EO. You've got hydrogen peroxide gas, plasma, and you've also got peracetic acid chemical sterilization. Each of those things have their own set of guidelines. And we're going to talk about those moving forward. Okay, so we got our definitions out the way. We understand the three classes, the Spalding classifications. We understand what sterilization and HLD is. Now let's get into the regulatory standards. And I'll just say this, whenever I was putting this PowerPoint together, there are so many things in sterilization or in a procedure area when it comes to these processes that I tried to put the most important things that I think would make an impact for you today and moving forward. And here they are. So like I said, again, we talked about low-level disinfection. This is just a reminder slide. From the CMS standpoint, you see that they have a requirement for this. Cleaners and disinfectants, including disposable wipes, are used in accordance with manufacturer's instructions. As we go through this presentation, remember MFUs. MFU is going to be an important thing that you may need to go back and look at your products or your process to make sure that you're following those. So take a note down right now, write MFU, and we'll talk about that here in a few minutes. Those things that we talked about when it comes to low-level disinfectant that are important is make sure that, number one, your products are within date, they're not expired. Number two, make sure that they have been approved for your facility. These products that you bring in, especially with COVID, we were using anything that we possibly could. Make sure that you vetted those products and that they're appropriate for your setting. And the last thing, make sure you use them right. So we say circle the contact time on the bottle. This is one of those low-hanging fruits that is an easy catch for a surveyor to come in and for your staff to not know. We do cleaning. We understand that we clean it every day, but are we doing it properly? Each of these wipes, and you can see on that bottle, has a time that it has to be on a surface called a kill time or a dwell time. Make sure that we're cleaning appropriately and according to those times, and make sure your observations are looking for compliance on those. And then wrapping it up, Joint Commission, the hospital reduces the risk for infections associated with medical equipment, devices, and supplies. We clean those items, glucometers, vital signs machines, anything to that extent. You want to make sure it's cleaned, and you want to make sure that you can indicate that it has been cleaned by either the way it's stored or by a position that it's in. So that is your low-level disinfection. So as we get into this, we've got our surgical procedures. And as you can see, it is a CMS standard, CMS 42 CFR 482.424I. And what I did is I copy and pasted what CMS puts out on this, because there's a ton of stuff in this. If you can, I want you to circle back on this presentation and look at some of these details, because just picking a few, you need to make sure that you perform a surgical scrub before donning sterile gloves for a sterile procedure. There's a lot that goes into donning equipment in a surgical procedure, and it lines it out right through here. Another thing is talking about sterile field and how to prepare sterile field and the proper way to address sterile field, how to not turn away from sterile field. More information about that is in each of these different line items for you to read. But again, like I said, CMS requires a load of things when it comes to surgical procedures. Make sure that you are familiar with those items, because like I said, it goes from everywhere from donning equipment to making sure a sterile field is kept, to making sure the ventilation is proper. It is across multiple different departments. And as you go through these different regulations, make sure that you have the right departments in place. If it's talking about ventilation, you're going to want your department or your manager of plant ops available, so he can tell you how that's even measured or if it's even measured. Whenever we talk about proper PPE, you want to reference your guidelines from the CDC and understand that if you use guidelines like AORN, what is the process to don and doff those things and what is required. So again, I'll put this up here so that you can go through this and refresh yourself on what goes on during those surgical procedures. But the biggest thing that we wanted to focus on in this presentation is the actual process that gets most scrutinized. So when we talk about semi-critical equipment, okay, this is 3A on our CMS checklist. We're talking about those semi-critical pieces of equipment like our endoscopes or laryngoscope blades, all those items. Our recommendations for your semi-critical equipment are make sure that you identify a list of items that need to go through high-level disinfection. Remember, semi-critical is things that touch the mucous membranes or non-intact skin. So do you have a list of areas where that happens? Do you have a procedure room that does endoscopy? Do you have laryngoscope blades in the ER? Are you doing any other procedures like vaginal ultrasounds in a clinic setting that require high-level disinfection? Make sure you have a list of those items or those areas where you perform this so that you can go back and check. You want to make sure that you have policies on cleaning and disinfection of your semi-critical equipment. So anything that we do, we need to make sure that we have a policy procedure behind that, and that the policy procedure can be an aid to someone that doesn't know the process very well, or can easily walk them through what is expected when they're performing those different tasks. Another key point we want to make sure you understand when it comes to this is only disinfect reusable items. There are single-use items that we have, and single-use items can be reprocessed under certain circumstances, but that is not very often the case. We want to only make sure that we disinfect reusable items in practice, or if we do have some one-times, that we verify with the manufacturer to see if it's okay. But for most times, you want to only disinfect those reusable items. You know, a lot of times we see this whenever we get some sample kits in for different things, or a physician has their favorite items that they want to use. Maybe those things are not reusable and we don't need to be disinfecting those because they're not built for that. Also, we're going to go through this, but pay attention to the details. Again, I'm going to reemphasize this throughout this whole presentation, is that for the past couple of years, surveyors, not only state, but your federal surveyors, have dove deep into the process for all those different things, even down to testing of the test strips. So make sure that you're looking at all those things, and we're going to touch on those key items as we go through this. More about semi-critical items, you want to make sure that with your endoscopes that you're processing, or different pieces of equipment, that you perform inspection of the items before, during, and after the leak test. So, you know, before you use the item, make sure, is that endoscope dripping? Is it clean? Is there gross soil on that? You know, during the process, is it functioning properly? Are we cross-contaminating from one area to the other? And then after, once we perform that leak test, did it pass all those things? All items you want to make sure you look for in that area. MFUs, they are key to the high-level disinfection process. So you'll see that you're going to have MFUs for not only the chemical that you use, but for the machine that you use, for the test strips that you use, and for the cleaning process. Your MFUs are your best friends. And we always recommend that you have a step-by-step guideline for anything that you clean per your MFUs, so you have no question. A lot of times we recommend for hospitals and clinics to put that on the wall of their processing areas to make sure that if surveyors come through, they understand that we have those guidelines up. And if we, you know, if we are confused about a step, we can always reference those signs in that area. Another area of contention is your cleaning brushes. You can see over here, it says to make sure that your brushes are changed appropriately. Many times we go in and the brushes look blown out, like we've been scrubbing floors or cleaning grout. If you notice that, have a process for your brushes that you use. Are they disposable? If they are, make sure you dispose of them between each use. If we are reusing those, make sure that at least they go through a disinfection process to make sure that they're cleaned. And lastly, on this slide, make sure that the lengths of time that you're following, as well as the temperature, is where it needs to be. Many times whenever we talk about semi-critical equipment, we talk about high-level disinfection, and those chemicals have certain temperatures or certain lengths of time that they require for you to either soak items or flush items. Even make sure that the temperature is there if you're just disinfecting items. All those things, if we are respecting our MFUs, you have to follow those guidelines. Or if it's unfeasible, you want to look at another option for your different instruments. Semi-critical equipment's moving on. After rinsing, you want to make sure that all of your channels are flushed and are not dripping after complete. So whenever we hang these items or we store these items, or are they visually clean, or are they leaking, and do they have things on those? Make sure that, especially with endoscopes, if you rinse those channels, that you flush those, you dry those things out, and you store those properly. On to our next item. You want to store those items to indicate cleanliness and to prevent contamination. From our laryngoscope blades, I know a lot of times that we'll just clean those and then throw them in a drawer. That's not the proper way to store those. You want to make sure you store those in a clean fashion and it's not cross-contaminating from one item to the next or just rolling around in a drawer. And for our endoscopes, whenever we hang those, we need to hang those vertically. And when it comes to vertical hanging, a lot of folks may have closets, either pre-built closets or standalone closets. Those endoscopes are supposed to be not in contact with the side walls or the floor. You want to make sure that they are hung vertically, and you can indicate that they've been cleaned either through a tag system or through a log on when you were able to clean those. Last, again, have a system to identify that. So if we were to walk into your area and grab something, how would we be able to know that it had been cleaned? And that is your, you need to think through that in your process at your hospital or your rural health clinic. Is if we're storing these items, do we have tags that indicate that they've been processed, or do we have a log that says when we have used those on a patient and that they've been processed? Okay, so that's semi-critical. Now we're going to go through the CMS standards for critical equipment. This is sterilization, like we talked about. These are those surgical instruments that enter the vascular system or sterile tissue. So we want to make sure what we see a lot of times when it comes to sterilization is we'll walk into a hospital, they've been doing surgery for a long time, and the policy and procedures were put together on a typewriter. I mean, they are hard to understand and they have not been updated since we started surgery. Again, things change. You want to make sure that your policies reflect your practice and that the guidelines that you were referencing, they may have changed since you wrote these policies. Make sure that your guidelines are in place, because what will happen is your surveyor will ask you, what guidelines do you follow? And then they're going to respect those guidelines in their assessment of your facility. Sterilization needs to be done in a proper area outfitted to do so. So if we have an autoclave just stuck in a storage room, is that the proper area? Is there ventilation in there? We need to think through that. Sterilization in a central sterile area, we need to think through traffic from dirty to clean. We're going to touch on more, but make sure that any sterilization that you're doing, whether it's in a clinic setting or whether it's in a hospital setting, is done in a proper area that is outfitted to do so. There are ventilation requirements, there are temperature requirements. You want to make sure that you become familiar with those, or that you talk to your facilities manager and you can look those things up to make sure you're following within compliance. Lastly, you want to ensure that all staff are trained properly and are proficient in the entire process. Again, when it comes to sterilization of instruments, from pre-cleaning to transport to disinfection to packing, I mean, there's so many steps in this that if you're not proficient in the whole process, things can be missed. And where our steps are missed in the process, that's where you have problems with spread of infection, hospital or surgical site infection, or with regulatory surveys, you're going to have problems there. Moving on for critical equipment, you want to make sure this is the biggest thing that you can do to start the process. Once the procedure is over, make sure that you pre-clean. Pre-cleaning is an absolute must. That is right at the bedside, making sure that anything that you use, any instrument that you use, a procedure that you've done, is that we remove all gross soil on those items as close to the procedure and as soon after the procedure as possible. The reason for this is that bioburden can harden on these instruments, especially if you're using scopes with different lumens, or if you're using instruments that have a lot of blood or different body fluids on those things. They can harden and they are extremely hard to get off, and that can cause you problems down the road. So pre-cleaning is an absolute must. And the industry is great. They've put together some great resources, especially for endoscopes. They have sponges that are already soaked for you to do your pre-cleaning, or for instruments. Have a process to pre-clean. It is the first step in the process, and it is absolutely important. Keeping instruments wet, that's the next thing we'll talk about. Again, we are trying to prevent the bioburden on these items from drying. So we want to make sure that in the time between the end of the procedure and the time that we get it into the processing areas, that we keep those instruments wet. A lot of times we see problems with this from a clinic standpoint. If we've got items we've used and we process in the hospital, how are we making sure those items stay wet before we transport those? There's multiple different ways, and we'll talk about that as we dive deeper into this. Packaging properly. There's so many different items when it comes to packaging. Integrity of the package, making sure your indicators are there, also making sure that we're not doing certain things like folding packages over if we double pack, all those things. CMS is looking at that. And they also mention that in their standards. And the last thing is indicators. Whether you've got a chemical indicator or whether you've got a biological indicator, having those present if they're required, and then actually knowing what they mean. We've had instances where we work with facilities and they had the indicators in there, and whenever surveyors ask us, did this pass? They didn't know. They didn't know what a pass or a fail was. So making sure that your staff understand what the indicator means or how it reads if it passes or fails is another important part that you want to have in your program. Moving on to critical equipment, document. Every little step of the process, you want to make sure that you log everything. You're logging the packs, you're logging the sterilizer used, the load number, the dates, all those certain things. And you can see that in this checklist. It gives you a good reference as to what you need to be logging. But you want to make sure that you log every time that you perform sterilization or that you do anything in these areas. Storage, another issue that a lot of times we find. Understand your requirements for sterile storage. Those items need to be stored in a separate area, possibly in a clean core or an area that's dedicated for sterile storage. And there are ventilation and temperature requirements for that area. So if you have that, that is an important piece that you want to make sure that they are done properly. The biggest thing that we see with sterile storage is compromised packets, or if there's expiration dates that a facility so chooses to use, expired things that just get pushed to the back. So that storage is extremely important, having all those items needed. Next, like I said, inspect for integrity. This is an important thing that not only after they've been sterilized or packed, we're looking at that pack to make sure that it held up through the process, no matter what that process was, and that it doesn't have any holes, it isn't overstuffed, and that the items that are sterilized are in the proper position. So, those are big pieces. Another huge point that I want to make here is with sterilization. A lot of times we see this in surgical hospitals is immediate use steam sterilization, IUSS. This is a huge issue when it comes to facilities. If you are not paying attention to what you are using immediate sterilization for, go check that out. What happens is it becomes more of a convenience to where it's an item we use. The indications for sterilization are not proper. And that trend is something that surveyors will pick up on, especially if they pick up that log and you've got a laundry list of instances where you had to use that. We can't just say that we have a shortage of instruments. We need to make sure that we educate our staff, educate our clinicians on the proper use for that. And we only do that in those instances. So that's another huge piece we want to think about. Lastly, to wrap up our critical equipment is there any kind of compromise? No matter what it is there a tear? Is it still wet on the inside? Is there a stain? Make sure that without a doubt, no matter what we do, just reprocess that item. Don't just leave it be. Make sure that you bring it back through the process and that everything checks out. And remember, make sure you have a system to track the different instruments used on the patients. Unfortunately, surgical site infections happen. And if we're going to do our root cause analysis, we need to understand if these instruments, maybe they had pitting, maybe they had rust, maybe they weren't processed properly. We have to have a system to track those things to recall what was used. So that's the big pieces from CMS. Now, when we talk about Joint Commission has had a huge push. They even put out a booster pack adhere, performing immediate and high-level disinfection and sterilization of medical equipment, devices, and supplies. That's your IC standard. 02, 02, 01 is in the top 3 that get cited across the nation. But you can see that this also leaks over into environment of care as well. So whenever it talks about the hospital conducts performance testing of and maintains all sterilizers, and these activities are documented, now you see how it can roll into an EC issue if we're not keeping our logs on everything that we're doing and doing our QCs on our sterilizers. Also, you can see the hospital implements infection prevention and control activities when doing the following: disposing of medical equipment, storing medical equipment, and when processing single-use devices, we implement those that are consistent with regulatory and professional standards. Remember, we don't want to disinfect or sterilize those single-use items, but sometimes if a hospital chooses to do so, make sure that you have a process and make sure that process is compliant. Okay, a lot of information. That was our regulatory guidelines. Now I just want to give you the tips and tricks with regulatory surveyors that we have found that will help you succeed. And we're going to walk through every step of the process in this chapter. So what are common issues that we see on a day-to-day basis? So common issues of non-compliance. The facility is not pre-cleaning at the point of use or improperly pre-cleaning. Again, like we talked about, this is one of the most important, if not the most important steps after the procedure to make sure that we are pre-cleaning those items. That is removing any bioburden, any physical material, anything that's left over after the procedure. We are cleaning it and making sure that it is done. The manufacturer's instructions for use are not being followed per guideline. MFUs, like I said, you took that note on your paper, MFUs. If you are not familiar with your MFUs for anything that you use, whether it be a chemical, a test strip, a device, or any item in your area that you're using for processing or procedures, make sure that you pull those MFUs, you have those available, and that your process is following those. You will be held to those standards. Policy states that we follow national guidelines, but the practice is not consistent with the national guideline. Remember that typewriter we were talking about? Those policies, if you have policies that have not been updated, you may be saying that you're following National Institute of Surgeons, or you may be following AORN. Well, if it states that, then if we have issues or we have to go do tracers that follow those different practices, they're going to reference those guidelines and make sure that you're following those. So be conscious of that. Sterilization is done at remote sites with storage, prep, and transport not being done correctly. Again, if it's being done at another place, say we have a clinic that transports instruments to a hospital, that or vice versa, a hospital cleans them, transports them to a clinic, or is that being done properly and are they stored properly? Ultrasound probes are not being disinfected properly. This was a huge problem, that was brought to light about vaginal ultrasound probes. They were being used, they were in contact with mucous membranes, but the reps were just saying that you could wipe the end of them with sanding cloth and you were good to go. That is false. So Joint Commission came out with these standards, and they've really pushed and encouraged the use of vaporized hydrogen peroxide in the form of Trophon. Trophon has a great system. Many of you are probably familiar with that. But if these vaginal ultrasounds are being done at different places on your campus, are they being cleaned properly? Or if you're using speculums that are in touch with mucous membranes, are those being high-level disinfected properly? Then the last, inadequate training or supervision for staff with no proof of competency or training. The easiest thing to find is if I've got somebody processing, they have no competencies or training. That's an easy thing to find. Make sure that everybody that is in that department has competencies or training. The best thing we always recommend is use a super user. So let your department manager or somebody in your department become that super user, and then they can train everybody and deem competence for everybody else. That way you don't have to keep bringing vendors back in. You can have that super user, deem them the super user, and then let them educate the rest of your staff. Common areas for risk. So when a facility adds new equipment to an area, say we're adding new scopes, say we're adding new pain management procedures, say we're adding say we're adding just procedures in general. New equipment's coming into an area, we need to be familiar with those items and how to clean those. Facility introduces new cleaning products for different items. So cleaning products change, the dwell times change, requirements for those cleaning items change. So again, remember we talked about temperature, dilution, storage, labeling those items. All those things need to make sure that if we have new cleaning products, we understand those. And a bonus tip, make sure you have the MSD sheets for those to understand that if there was an exposure, how to treat yourself or how to treat your staff member or anybody that does get exposed. The facility has new uses for existing equipment that needs extra steps completed. So this could be using scopes for a more invasive procedure. Make sure that if that is the case, that your practice for decontamination or sterilization or high level, whatever you may have to do, make sure that it includes all the steps that are required. A facility adds new staff to its department. Again, make sure your staff are trained and competent. And the facility has a new location or new locations that it's functioning out of. Biggest thing we see here is if we add a new space, is the ventilation calibrated correctly? Was there a terminal clean done? And is the area ready to take its first case? Those are the big things. And if you're functioning out of a space, make sure you're looking at your different areas. You know, you've got restricted areas versus non-restricted or semi-restricted areas. Are those identified, and does my workflow work with those boundaries in place? Ask yourself questions to ask as you're walking through. Okay, what services, equipment, supplies, items can be contaminated? What are those? When am I required to clean and disinfect? And then what is the frequency of that? Who is responsible for cleaning? Who gets the responsibility? And then do they know that they are the person, and are they educated and competent to do that? Are we just dropping somebody in from another department and telling them that we need them to disinfect scopes? Or is that person, they understand that that's their responsibility, they've been trained and they're competent to do that, and they've been vetted? How do you know? Well, how do you know if an item has been cleaned or disinfected when you see it? So if I see scopes hanging in the cabinet, or if I see a vital signs machine on the floor, or if I see instruments that are, sterile instruments that are stored in a sterile core, how do I know that they have been cleaned or disinfected? What's your indication? Make sure that you understand that. And then where are your policies located? And if you had a question, or if your staff had a question, would they be able to access them? If we're going through a process and we have something new or a new issue that comes up, do we have items that are resources to educate them to say, hey, this is what you need to do in this situation? If you are not available, where are those located, and do they have access to those? Prep yourself. Of course, anytime we are dealing with other people's body fluid, other people's, any item that can contaminate you or contaminate others, you need to be protected. So whether you're processing, whether you're in the OR, whatever you're doing in that area, make sure that you have on the proper attire. So we talk about the proper sterile attire or surgical attire being a head cover, a mask, a gown, gloves, leg covers, booties. We want the whole thing covered. Big things to look for here are skull caps. Are the skull caps coming in from the outside? Are they being laundered? Or what is your process to make sure that those are clean if those are worn in the procedure area? Another thing is beards. What's our process? Can we cover those beards? Do we have masks for beards, or are we just winging it? And then another one is goggles. Are we mixing chemicals, or is there an exposure risk to where we could have caustic effects to eyes, to skin? Especially when it comes to eyes, we want to make sure that we have goggles present or a face shield present. So make sure that these things are available for your staff, and make sure that they have availability to those, and that they're not reusing if they don't have to. The process is already tough enough, so make sure that they have the equipment that they need. Always remember, so I'm going to preach this, disinfection and sterilization requires pre-cleaning. So pre-cleaning is the first step in your disinfection. The point of this step, again, is to remove all soil that is visible on the items, whether it be that we just had an I&D and we're cleaning different instruments in that ER room, making sure that we don't have any blood, or if it's a scope that we've just used and we need to get the, different things off the outside of that scope, make sure that we're pre-cleaning. It's best practice to make sure that this step happens immediately after the procedure, or as close to the procedure as possible. And that when those things are done, we keep those wet and we transport those to the processing area as quickly as possible. Now, again, I realize that we're going to have things that we can't take immediately. And in those instances, you want to make sure that you use a spray that can keep those wet. Many of the vendors can provide you with a spray. Our recommendation has always been Forever Wet. It's an easy spray. It lasts for 72 hours, which gives you a buffer to make sure that you can get those to the proper processing area. But again, best practice is get it to the processing area as quickly as possible. And then items need to be transported to the processing area in a safe manner. So this is an OSHA standard. Anything that we use that could potentially injure an employee or somebody working in the facility, it needs to be contained for transport. So in this picture, you can see that these rigid containers are what we recommend. And this is another slide that we have about that. You want to make sure that all of your items are contained to protect the person transporting them. So when we transport, we don't have instruments sticking out, or we just lay them and put a sheet over them. Accidents happens, things can happen. Make sure that those are closed in a box and that we're transporting those safely. Another thing with that box is you want to make sure that you indicate what's in that box. So if it is biohazardous material, make sure that it has a biohazard label on the container. Now, another thing I want to talk to you about this is the process. So if we've got a box that's biohazard and we put our instruments in it, we spray it, we transport it to disinfection. Now, what does it look like if we use that same box to transport it back to the area we brought it? Is that still a biohazard box, or do we have a process to clean that box? You want to think through that process and what the visuals are when it comes to that. So again, you need to transport dirty in a dirty container. Make sure that when you transport clean back to where it's going, that the container has been cleaned and it's indicated. Okay, disinfection keys. These are the hot topic items when it comes to those. Remember those little items that we talked about? So follow your MFUs. When it comes to chemicals or disinfection procedures or test strips, you're going to make sure that you have the correct dilution. If there's a dilution required, make sure that you understand that. And you've got a measurement device that can measure the proper quantities so that you can dilute it properly. Correct contact time. You got to have a timer. And what you want to do is you want to log the start time and the end time just as evidence that you did this properly. Correct temperature. If your high-level disinfection solution requires a temperature or sterilization method requires a temperature, we document that and that it stays at that temperature or within that threshold. Correct testing procedure. The test strips that you use require to be tested to start. Does the solution require to be tested daily? Whatever your MFUs say for those items, make sure that you've got a log that demonstrates that you're doing that and that you're performing those items. Correct expiration date. This can be based off of when you open an item. You can set a standard and a policy in your facility for a set amount of days, or you can go off of the actual expiration of the chemical or use the chemical life. Whatever your expiration date that you set is, or per the manufacturer's guidelines, make sure you follow up on that and you label that expiration date so that it can be removed and replaced. Correct log. So you want to make sure that if you're tracking temperature, you do not have a ventilation log, or if you're tracking ventilation, you don't have a procedure log. You want to make sure that the log correlates with what you're tracking, and that you don't just reuse old things for multiple different purposes. And then the last is the correct staff competency. So going back to, I know I mentioned Trophon, make sure that if you're expecting your staff to perform Trophon or to disinfect using Trophon, they have been educated and they are competent to that process, and you got documentation of it. Keys, things to keep an eye out for are unattended carts with contaminated instruments. Sometimes they'll just push, we've got a ton going on, we push these in the hallway and we forget about them. Pay attention to that. Issues that delay the process. Remember, we want to get it to that disinfection area as quickly as possible. What's going to delay that process? And if it's going to be delayed, are we keeping the instruments wet? Items left soaking for extended period of time with no log. So, we've had instances where instruments in a container of fluid, not labeled, no timeline. I mean, what are we doing here? The surveyor wants to know how long have they been in there? What is the solution? Is it dangerous? All those items you want to make sure you look for. In the decontam area, when you pass through there, you want to make sure that your PPE is worn properly. There's a clean separation of dirty and clean, especially when we talk about that linear flow. We want to make sure we think, how do I go from taking dirty instruments, processing those, and then moving them to clean. Remember, we talked through linear processes for a couple of things. It's the same here with the decontam area. Ventilation and temperature, all different areas per FGI have requirements, especially in these specialty areas, in your disinfection area, in your sterile processing, sterile storage, and in the OR suites. If you're not familiar with those, get with your plan ops or your director of facilities to make sure that you understand what the requirement is and how to measure that. No risk of overexposure. If you've got caustic chemicals, is there proper ventilation, or are we in a closed area where it's going to adversely affect your staff's health? Make sure there's no risk there. Step-by-step process. Again, this is, I think, the easiest way to evidence compliance is have each step of the process laminated on the wall, and it follows your linear process. It's just a great visual, and it's a great way to take someone that doesn't quite know or may not be familiar, and they can just follow the steps and process the instruments. In the decontam area, when you're processing, you want to make sure that if you pack items, that hinge or that ratchet shut, those are open. This is another easy finding, that those things can be closed and can't be disinfected properly. You want to make sure that those are hinged open so that they can completely be decontaminated or sterilized. And then cleaning is done properly with the brushes. We talked about this earlier. Do not reuse brushes. And if you reuse brushes, make sure that they don't look all blown out, or that we clean them properly, whether sterilize them or put them through a high level disinfection series. Make sure that we clean those. The worst thing you can see is just some old golf brushes sitting on top of the sink, and the bristles look like this. They're all over the place. Have a process behind that. So, this is a good point for the poll, Danae. I'm wondering, how many of you walk through your surgical or procedure areas? How often are y'all walking through those areas? So we've got never, we've got annually, we've got monthly, and we've got weekly. So, a lot of times in a hospital, we depend heavily on our director of surgical services to make sure that that area is clean, or make sure that we are following the process. So, it's extremely important for us to put an eye on that, because as the infection preventionist, as you saw in those standards, we are required to provide oversight for those things. So let's see, we got 7 out of 15. We've got some never have been in the surgical procedure area, which, that's okay. Today is a perfect day to start. Annual, we have some that go there once a year, monthly, and then weekly. So no, that's great. We'll give it a few more seconds to answer. But yeah, as you can see across the board, some folks are putting a lot of focus on this. Some folks haven't even put it in their actual practice. But hopefully we're bringing up some things that you can think. You could think on and pass through. We always tell the story of the bubble effect. If you are in an area, and it happens all the time when we come into a facility. If I'm in an area, I've worked there for the past 20 years, I've been the director of OR, I may walk in and not notice things. An outside set of eyes that comes in may right off bat notice something. Oh, well, this, you got a leak in endoscope, or you got the filter in your endoscope closet isn't even out the plastic. There's so many things that they may be just caught up with the hustle and bustle of the suite or the service line, that they're not paying attention to the little things. So, okay. So good. We got good participation, and it looks even across the board. So we got never, annually, monthly, and weekly. So no, that's great to know. All right, so we'll get back to this. More keys on disinfection. Again, you want to pack your items properly. You want to make sure that you wrap and pack based off the IFUs. Can they be packed? Other things to look like. Do not fold over inner paper plastic peel pouches. Double packing. This can get you in trouble. If you know how to do it properly, it won't get you in trouble. But there are some guidelines that they do not want anything folded over on that first packet that you insert into that second packet. Make sure that the packs are appropriate size and that they fit those areas. And do they really need to be double packed? Ask that question. Ask why are we doing that, and understand the reasoning. It may be something, well, we've always done it like that. You may be able to save yourself some hassle. You want to write on the correct area of the pack. most times we recommend to write on the paper, not on the plastic, just because it's been shown that that plastic can bleed through with that marker on the paper. It is on the exterior, and it has been approved by regulatory bodies. So we always recommend writing it on the paper, but look at your policy and see what it says. And make sure you're following that. And then discard any packs that are torn, stained, or damaged. Make this a regular practice. Go around in your OR, your procedure area, look at these packs, and you see that right there. That's pretty sharp. Has that busted a hole, or do we have a little compromise in the package? In this, is it stained? Do we have any tears? Any of those items are going to render it useless in the eyes of the surveyor, and it's going to be needing to be reprocessed before you utilize that item. Document all items. Again, all required elements from the sterilizer based on your IFUs, you want to make sure you document. If you test it, if you process with it, if you use chemical indicators, if you use testing strips, all of that needs to be documented, and making sure that you have evidence that you're not doing it every now and again, that you're doing it every time for the things that require every time. All right. More disinfection keys. Again, chemical indicators and biological indicators. The biggest thing I can say when it comes to testing and indicators is make sure your indicators are not expired, and then also make sure that they are not reused and your staff understands what is a pass and what is a fail. When it comes to spore testing, that can be an intricate process. Make sure you ask questions around, are we required to do spore testing? Who are we sending it out to? And are we receiving those reports back? A lot of the times we're doing it as a formality, but we aren't even looking at the reports when they come back. And there may be some issues that we recognize. Make sure you get with whoever's over your surgical or procedure areas to look at those indicators and understand where you can access those reports. It's a big item here on those, but especially make sure they're not expired and make sure you know what they mean. Know your expirations. Again, based off your facility policy and procedure, this is what we have always said. Whatever your policy is in your facility is what your regulator is going to respect. So if you say, once this surgical instrument has been sterilized, if the package is uncompromised and the temperature and humidity have stayed within guidelines, then it does not have an expiration date. Other facilities choose to say after a certain amount of time on an annual basis, we make sure to reprocess. Whatever your guidelines are, whatever your policy and procedure is in your facility, make sure that you respect that and that you follow that. Again, packages that are torn, punctured, wet, stained need to be reprocessed, no ifs, ands, or buts. And then make sure you use a timeline and it's written on those instruments indicating when it's been cleaned and on the right area. All right, sterile storage, biggest things here are with your sterile core. There are certain things that need to be there. You want to make sure not a lot of people are passing through there. You don't need traffic, folks coming in and out of there. Only the folks that need to be in there need to go through there. So think about traffic control, your ventilation, temperature, and humidity. There are ranges that you need to keep. Make sure that they stay in there. And if those are out of range, how would you know? If you got a thermometer in there and it drops in the middle of the night, how would you know that? Can you go back and look at that? Or is your facility notified of those different items? How does that notification? And then what is the process if it falls out of those things that you reprocess? Housekeeping, make sure that you give housekeeping access, but they wear the proper PPE when they come through to clean those different areas. Understand your policy on shelf life. Make sure that the items are stored or not compromised. So are sharp items piled on top of each other, which are going to cause holes in the packs, or are they all separated and stored properly? And then also, again, log items. We want the following record: a lot number, load contents, temperature, exposure time, all those different things. We want to make sure that we have those documented in our logs. Problematic areas for you to look at. These are the things that we've always seen trouble with: surgery and endoscopy. Those areas always may have some little issues that we found. See how there's so many little technical areas. That's a problem. Any area that uses Sidex of any type. So if we've just got buckets of Sidex hanging out in clinics or hanging out in different areas, those can be problem areas because many times they're not following MFUs or keeping those logs. ERs, nurseries, and dental clinics. it's a second thought. But in those areas, we have items that either touch mucous membranes or touch the sterile, the vascular area or sterile space. So you want to make sure that those areas are looked at if you have those. Storage areas across campus. So, how are we storing in the hospital versus the clinic? Is it proper? What are we using them for? All items to be aware of. And then clinics in hospital and offsite. A lot of times, whether you're a provider-based clinic and you're supposed to have oversight from those different bodies, sometimes that doesn't happen. And we've got practitioners that have been stuck in their ways and that do things a certain way, but that way is not following hospital guidelines or manufacturer's guidelines. Those are your problem areas. Hot topics. Again, I think we beat these to death today in the presentation. MFUs. I cannot explain how important it is to pull those MFUs if you don't have them and make sure that you're following those. Proper storage. Again, we talked about laryngoscope blades, we talked about endoscopes, but making sure that those things, if they require storage a certain way, that they're stored properly. Transport of dirty items from clinics to main campus. That's a huge issue. Are we keeping those instruments wet, or have they been sitting there for 7 days and we're finally getting around to moving them? Big issue there. Items you want to pay attention to. Competencies for documented for staff. Make sure again that our recommendation, have your super user train with the company. After that, let them train all your staff, but make sure that those competencies and that education is done annually or as often as you require it. We recommend annually, and when there's instances of non-compliance. And then proper sterile techniques or break in sterile techniques. A lot of things can happen in surgery. We like to think that it goes perfect every time, but things happen, emergencies happen. If those things are going on, or if instruments are dropped, or if we need to access certain things, are we paying attention to sterile technique? Are we making sure that those items are in place to make sure that our patients are safe and that we're not spreading different infections? So how to succeed? A great orientation and training program that covers all bases. This is huge. Make sure that when someone's coming into the department, they know exactly what to expect and exactly how to do things in that department. Ensure that you have appropriate staff that are supervised. You don't want to be short-staffed processing endoscopes and trying to get 25 done by 10 a.m. That's just infeasible, and you're going to have problems there. Make sure you're staffed up for what your case volume is. Standardize the process. Step-by-step signs, awesome to have. Reinforce best practices, and when possible, be a resource for existing or future staff. If there's new literature, if there's easier ways to do things, if there's cleaning chemicals that don't require as much, setup or cleanup, look for those items. Try to help those folks that work in that department make their job more efficient or easier. And then consistent monitoring for compliance with education provided as non-compliance is found. Make sure you wrap surgery procedures into your normal rounding that you do in your facility. Don't isolate those areas. Make sure you're involved because it is a huge piece. Surgical site infections are a huge piece of this. Also, give yourself credit for your hard work. If you do anything, if you correct anything, if you identify anything that needs or that can be more efficient, that is out of compliance, that you fixed. Again, we talked about quality last time, but give yourself credit through either a quality project, take pictures of what you did, write a little story about how you increase this, maybe look at your surgical site infections. Give yourself credit for the hard work you do. At the end of the day, that's the one thing that us preventionists don't do. We do so much, but we don't give ourselves credit. And you need to have the stuff that you can brag about whenever survey comes around, that you are proud of, that you're not only protecting your staff, but you're protecting your community. Okay, a lot covered, and I think I did it within an hour. Spot on, right at 1 o'clock. Reminders, let me blow through those. We've got more webinars. We've got another advanced on hospitals, September 15th. We're going to be talking about hospital-acquired infections, CAUTI, CLABSI, SSI, ventilator-associated infections. We're going to get into the nitty-gritty on that. We've also got a advanced on rural health clinics coming on August 30th, talking about, again, a lot of the stuff that we covered here, except in the rural health clinic setting. Assessment applications. If you've not filled out an application, we've got a few more spots available. We will be calling many of you on this call because you've already qualified, and we'll be trying to schedule dates for our team to come on site to do an on-site evaluation, do a walkthrough with you, answer any questions, provide resources, and me and Danae's favorite part, give you free supplies. That's what we're so excited about. And if you haven't signed up, make sure you fill out the application. And again, thank you so much for letting me be your host as we go through these things. I know a lot was covered, but if you have any questions, you can always reach out to us. There's our phone number, our email, or reach out to Danae, and we can absolutely help. So to close it out, was there at least one thing that you learned on here that you can go and verify today in your areas or adjust in your facility that we talked through? And we talked through a lot. Danae, did you learn something today?
I did. I've not been in the surgical area, so learned lots of stuff.
Well, good to hear. Good to hear.
I'm also going to go ahead and post in the chat here the full post survey. If you guys will take that at your convenience, it'll also go out via email. And then the recording of the webinar will be up within the next couple of days on our website, along with the slides. So be sure to check that out on our website. Looks like everyone's answered, so I'm going to go ahead and end the poll.
Perfect.
So that's all we have for you today. Thank you guys so much for being here, and look for an email from me with the recording and the slides, and we hope you have a wonderful afternoon.
Thank y'all.
Thanks so much.